Welcome to Empowered Health. We have a really interesting show this week, full of information to help you take control of your health.
PJ, it's always interesting, and today is no exception. Today we'll be talking about the raw milk craze and check in with some more incredible research the chiropractors have to share with us.
Michelle, I can't wait, but first, we're going to hear about Neil Callow's health journey. Let's take a look.
2 years ago, there's no way you'd have seen Neil Callow working in his garden like this.
We were loading the truck and the next day unloading it and then carrying boxes upstairs to the various rooms. And I didn't really notice any problem the first or second day. And the third or fourth day, I felt swelling and pain in both of the elbows.
Neil wrote it off as just a sore muscle, but the pain got worse, to the point where he couldn't even pick up a cup of coffee.
I had to sell my boat and my canoe because I couldn't lift them, and I thought, well, how on earth am I going to paddle a canoe? And I finally went to my doctor and said, what on earth is going on here?
Neil was diagnosed with an aggressive form of tendinitis, where the tissue that connects the elbow joint is severely scarred and torn, causing great pain. So what to do? Well, his GP gave him a referral to a physiotherapist, and he also started with acupuncture treatments. But
it just came back. I'd lift that shopping bag or lift a bucket of dirt. It just got very bad again. And I went for 12 treatments of these various therapies. I was getting nowhere.
Desperate for relief, Neil recalled a time when he had engaged shockwave therapy for another injury. It had worked well then, so he decided to see if it was applicable this time.
Shockwave therapy delivers high-intensity sound waves into the body as a way to stimulate healing. It causes the body to grow new blood vessels into an area, which brings all of the things that the body needs to heal. It's also used for certain conditions to break things up, like scar tissue or calcium deposits that can get into a muscle or a tendon.
So I went back to the same clinic, and after about 4 treatments, I noticed an improvement. I went for a total of 5. They recommend 4 or 5 maximum.
We can apply it in a very specific, isolated way. We can control the exact intensity and dosage in which we are delivering this stress, and we can target to those areas that the person wants rather than exercise where you're just exposing a huge portion of your body to a similar stress.
But you have to be patient and wait up to 6 months to see the full effect, and I was amazed how it helped me. It almost completely cured it, and then after the 7th, 8th month, it went away.
Although there is evidence to support shockwave therapy, the jury is still out when it comes to its efficacy. But for Neil Callow, he's back to gardening and feeling great, and he says it's shockwave therapy that made all the difference.
It's a miracle. It saved me in 2009 and 2011.
Coming up on Empowered Health.
The milk we buy in stores is heat pasteurized, a process that destroys some vitamins, enzymes, and beneficial bacteria. Raw, unpasteurized milk contains all of the above. Do the perceived benefits of drinking raw milk outweigh the potential dangers?
Milk is a huge part of many people's diets. But what exactly is raw milk? Is it better for you than regular milk? What exactly is healthy when it comes to milk in general?
You know what, it certainly gets confusing, especially with all the milk substitutes thrown into the mix. But luckily, Randy Shore is here to enlighten us. Randy?
The milk we buy in stores is heat pasteurized, a process that destroys some vitamins, enzymes, and beneficial bacteria. Raw, unpasteurized milk contains all of the above. We don't need to argue about that. The question you really need to consider is this: do the perceived benefits of drinking raw milk outweigh the potential dangers? The raw milk debate is raging in newspapers, on the web, and in the courtrooms across the land. Raw milk advocates don't want the government telling them what they can and cannot eat. I totally understand that. They have websites full of self-appointed experts and apocryphal tales of raw milk curing everything from scurvy to psoriasis and tuberculosis. A lot of these tales are so outlandish it tends to undermine their credibility. But I'm willing to overlook that for the moment, because there is a grain of truth in what they say. Pasteurization does destroy vitamins C and B12, and it does kill lactobacillus. it probably also harms the natural antibodies in milk. Like breast milk, cow's milk contains everything a baby needs to thrive. Well, it contains everything a baby cow needs to thrive. But it's possible that human babies can benefit from those antibodies too. In one of the few legitimate peer-reviewed studies on the health benefits of raw milk, scientists at Johns Hopkins University found an antibody found in raw milk inhibits human and bovine rotavirus that can cause diarrhea in small children. The researchers concluded that altering milk processing procedures or adding the antibody to infant formula might be useful if it preserved the antibody for human consumption. They did not advocate giving children raw milk, nor did they give raw milk to any humans in their study. All that happened in a petri dish. Oh, they also mentioned that the antibody was present and functional in pasteurized milk too. There really isn't any good science to back any of the claims made by the raw milk people. But I'm still prepared to concede that a natural, unprocessed product might convey some benefit to the consumer. The question remains, should you drink it? Raw milk is a rich and nutritious product. Now that makes it an excellent medium for bacteria. Now there are good ones, like lactobacillus, which you can easily get in much higher concentrations in yogurt. There are also bad ones, like salmonella, E. coli, and listeria. The food processors and government regulators go to a lot of trouble to avoid passing these bacteria along to the public. The tiniest trace of E. coli is enough to send millions of kilos of ground meat to the landfill. The proven cost of consuming these harmful bacteria is illness, organ damage, and even death. Raw milk has been implicated in outbreaks of illness across North America involving hundreds of people. So the question you have to consider is this: is the unproven benefit or the great taste of raw milk worth the potential cost to you or your child? I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Paul Bruno, who is looking at rehabilitative exercise strategies.
Well, what we're doing is using motion capture to actually record movements and using electromyography to actually record muscle activity during certain movements and during certain clinical testing procedures. And then using that information to try to tease out what are the movements, what are the muscle activation strategies that are most pertinent.
The goal is to gather this information, analyze the patterns, and apply it to what is detected clinically to better understand what treatments patients with back pain respond to and why.
There are plenty of studies out there that have shown that different types of chiropractic treatment, be they spinal manipulation, exercise therapy, work. Again, what they really are sort of finding, even for like spinal manipulation, is that it works for some types of patients and not others. So what we need to do, like in any kind of treatment, is determine which type of treatment is most effective for each person. So finding out, okay, this is the group that works, and then again trying to find out why. This type of exercise therapy seems to work for certain types of patients. These are those patients that it works, and here's why.
It's through this type of research that we are able to provide designer solutions to each of you. Solutions that include movement, promote blood flow, enhance mobility, and help reduce or eliminate pain.
That is the ultimate game, is to get to those research trials and then to do those trials and then to sort of get that information out to the different practitioners so they can use it with their own patients.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow through better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Hey guys, this is your Simple Fitness Tip. My name is Jameson Wolf, and this is Simona Marion. Today we're going to show you effective forms of cardio and how to progress. Although weightlifting is the most efficient way to lose body fat, get stronger, and build muscle, cardiovascular training is an important part of overall fitness. Now, depending on your fitness level, you may want to start with just walking or jogging about 15 to 30 minutes. Once you get good at that, you can start to move up to higher intensity training or interval training. Generally speaking, you can start as low as 50 to 60% of your max heart rate. And as you get more fit, you can work up to 75 to 90% of your max heart rate. And this is where we get into methods such as sprinting, where you sprint for 10 to 15 seconds and then rest for 1 to 2 minutes and repeat. Generally speaking, you're going to be doing cardio for 15 to 30 minutes, and as you get more fit, 15 to 20 minutes at a higher intensity. This is a great way for cardiovascular training to lose body fat and maintain muscle.
After the break.
Let's talk about someone like an accountant who sits in front of their desk all day. What kind of lenses would they want to use? We can have lenses that are really geared for that kind of distance.
Michelle, we've seen some great segments on this episode already, but now we're going to switch gears to our eyes and our teeth.
Dr. Bahi is back on the show to talk teeth in our reoccurring dental segment, and we're going to get some very important tips about how to choose proper eyewear.
In a previous segment, we discussed the benefits of replacing teeth with permanent dental implants. Today, we'll meet another one of our patients that has undergone this treatment. Dave Babbage is probably one of the most memorable players from the Vancouver Canucks. He is currently an assistant director of player personnel with the team. Like many hockey players, at the end of his 19-year career, Dave found himself missing a few teeth. I saw Dave, evaluated his teeth, jaw, and bone structure. I discussed the option of dental implants with Dave because he was a good candidate. Dave has now completed the treatment.
I was never a big fan of a dentist chair, ever. And this was real easy. Well, there was, situations where it wasn't, the stuff that was done wasn't permanent. And now, when you get to a certain stage in life where you can actually do something permanent without worrying about them being knocked around again, it was good that I found New England Dental Surgery. They do, I guess no better word, drill into your gums to put the post in. And I thought, boy, that's going to be major. And to be honest with you, I was in and out of there in 15 minutes, top to bottom, without any pain. And, sure, there's a little bit of residual pain after, just for a day or so. But after that, I was fine. No bleeding, no worry about any of that kind of stuff. I was really pleasantly surprised. I'm happier than hell with it. I couldn't say more. I would recommend anyone to do the same if they're ever even considering looking at those kind of options.
Let's talk about someone like an accountant who sits in front of their desk all day. What kind of lenses would they want to use? We can have lenses that are really geared for that kind of distance where you're looking here and here. So it depends on what you're doing.
Exactly. Choosing the correct lenses is very important, and it's different for everyone. The great news is there are more options than ever.
As a doctor, I really like to sit down with a patient and talk about their lifestyle and how they use their eyes. And then we have tons of, or a plethora of lenses to kind of choose from to match their lifestyles.
Lifestyle factors like, do you spend a lot of time on a computer? Do you spend a lot of time outdoors? Are you physically active? These are just some of the things that need to be considered when it comes to ensuring that you get the right lenses for you.
There are digital design lenses that we would recommend in all cases for all our clients, but we would add technology to the digital design lens depending on what their needs are. We'd be a little more specific with the technology that we're choosing for the client.
Yeah, I think a lot of people forget that lenses aren't as simple as they think they are, right? There's a lot to a lens. The quality of the material that's being used, how that material is being cut and made into a frame. Is it being stamped like mass produced, like those over-the-counter readers that people use? That's usually stamped out of a big piece of sheet of plastic. And so that doesn't work so well because it induces a lot of distortion.
Let's say you're an accountant, but you also very much enjoy doing outdoor activities on the weekend. I can offer you lenses now that will help you during the week so that you can be in an environment where you're not having as much eye strain and be more comfortable during the week to have the intermediate and near vision brought up in front of your vision and see a beautiful, easy vision, less headaches, less eye fatigue, less eye strain. And then also offer you lenses in a separate pair of glasses that would make you comfortable for when you're out running or jogging or living your life outside of work as well.
There's always an adaptation when you're getting a new pair of glasses. For some people it's a day, for some people it's an hour, for some people it's a week. So for a lot of people, they expect to put on the glasses and see clearly right away. And for a lot of people it works out that way, but for some it doesn't, and it's okay if it doesn't. Just try the lenses out, and if there's any problems, you should visit your optometrist after about a week of trying it, and then they'll address those concerns.
Working with a licensed optometrist and optician will ensure you get the right lenses, and they'll work with you to ensure you experience better vision.
So you really got to get educated. And that's where the optician and the optometrist work together, right, to come up with the best game plan for the patient.
Coming up on Empowered Health.
So this is avocado and chickpea salad. So avocado and chickpea has such amazing health benefits.
This cooking and nutrition portion brought to you by Save On Foods.
Every time chef, author and TV host Belle, the Spice Goddess, is on the show, she shares an amazingly simple recipe that is also very delicious. And today she's got a recipe for us from her book, Belle's Quick and Healthy Indian. Belle, welcome to the show.
Well, thank you for having me. And guess what? This recipe is so quick and so healthy.
And
exactly like what the book says.
It involves no cooking, right?
It involves no cooking. Okay, so this is avocado and chickpea salad. So avocado and chickpea has such amazing health benefits. So what I'm going to do is add my spices, beautiful spices, and I'm just going to bring all those flavors together.
With green onions, they taste great, okay?
Yeah, so for our salad dressing, it's very, very simple. I love, again, you know how much I love my ginger.
Yes.
So tablespoon of ginger, again, amazing health benefits, but it has a really nice, it gives like a sharp bite to the flavors. I'm just going to have tablespoon of, I say tablespoon, you know it's tablespoon.
Yeah.
And then just a little bit oil. So 3 tablespoons of oil.
That's olive oil?
Yeah, olive oil, yes.
Okay.
And then to, like a tablespoon of lemon juice. I'm gonna make a little bit extra.
Okay.
And now to my spices, cardamom. Oh, love cardamom. Cardamom has a really nice floral flavor. So I'm just gonna add pinch of that.
Okay.
And then a paprika is going to give it a really nice color. It's a smoked paprika.
Okay, and also for a bit of the kick to the flavor.
Teeny bit kick, but a really nice smoky flavor. So it's not too hot.
Okay.
This is perfect. And a little bit salt to your taste.
Yeah.
And cumin powder gives a really nice, warm, earthy, that Indian flavor.
Absolutely.
Kind of, yeah. So that's our salad dressing. So I'm just going to mix it.
Mix it all together.
Mix it all together.
It looks so good as the colors are all coming together.
Yes. So now this dressing is ready. How quick this is. Like for me, like even, so good.
You could just have it on its own.
Yeah, you can. You can. Just a little bit salt though.
Right.
So for our salad, again, chickpeas. These are just canned chickpeas. I wash them.
Or you can pre-soak them overnight if you want.
I do always, big pot of chickpeas night before. I bring it to boil, let it sit, and next day then I just use them.
Right.
And so just a little bit green onion to give a really nice color.
Yeah.
And then green onion has like really a sweet flavor.
Yeah.
So I'm just going to have maybe 1/4 cup of green onions.
Chop.
Chop.
And it
goes in. So here, this is my favorite. Like it's so easy. Look how easy, honestly, this is. You cannot go wrong with this one. And this is a really good time to add whatever else you want. You're going to add cranberries. You can have toasted almonds to it. Whatever flavors you like.
See, the best thing I like about your cooking, Belle, is that all the ingredients stay in their original form, but they all come together to make this great recipe. And that's exactly what's happening here right now as well. I can see that. Yeah. And the best thing is no cooking required.
No cooking. And it's really quick and really healthy.
That's my kind of time in the kitchen.
So here's a salad dressing.
Perfect.
Just gonna go. And that's it. How fabulous is this?
Is that ready now?
That's ready.
Wow. Thanks, Belle. The avocado chickpea salad. Just what I expected. Like, how many adjectives can I come up with to praise the food that you make?
Oh, thank you. I think it's all the spices, and I think all the flavors, you know, the sweetness, and then you have this, you know, lemony flavor, the citrusy, and all those beautiful spices, and I think they just do a great job. Yeah,
absolutely. It's simple and it's healthy. Well, thanks for being on the show, Belle, and thanks for teaching us this recipe.
Thank you for having me.
You've probably heard of the concept of eating foods when they're in season. I've got registered dietitian Crystal Higgins here to help us figure it out. Crystal, welcome to the show.
Thanks, BJ.
So are foods which are in season really more nutritious?
Well, if you've ever had a freshly picked peach off of a tree in the summer, you know that it certainly tastes better than one that's traveled a far distance away. So it really comes down to the more flavor it has, the more nutrition it's also likely to have.
I think when it comes to growing seasons, we are really fortunate that in BC, the growing seasons are really long.
Absolutely, and it's all about supporting your local economy, supporting your local farmers, and just overall sustainability.
That's so true, Crystal. What should be done if a recipe calls for an ingredient that's not in season?
Well, if you need an ingredient that's not locally available and in season, the next best option is to go to a frozen option. And frozen fruits and vegetables actually have a very similar nutritional content to those that are fresh. In fact, they're picked at the peak of their perfection, so they retain more of the nutrition. And something like BC blueberries are available year-round in the frozen section, and they're easy to freeze yourself. So if you pick lots in the summer, you can simply just rinse them off, put them on a baking sheet, and freeze them so that they freeze individually, which is kind of neat too.
That's a great tip, Crystal. Is there any resource available which can tell me which particular produce or fruits or veggies are in season at a given time of the year?
Definitely. There's lots of resources that are out there. One of my personal favorites is one called getlocal.org, and they have a very user-friendly chart that you can refer to there.
Well, Crystal, I'll tell you what, unlike some produce, great advice is always in season, and that's exactly what you've given us today on the show.
Great.
Well, thank you.
Thank you.
Well, that's all for this episode of Empowered Health. As always, I learned a lot. And guess what? I got to try another amazing recipe from Chef Belle.
Make sure to follow us on Twitter, stay in touch, and we'll see you again on Empowered Health.